So I'm Terri Lovis. I'm a GP partner at the Woolhouse Surgery in Reigate, and our practices are part of Care Collaborative PCN, which is Woolhouse, Greystone House, and Moat House surgeries covering Reigate, Redhill, and Merstham. And I'm also the acting associate dean for Surrey Training Hub. So we were a Wave 1 site for vaccinations, and we recently did the care home vaccinations using the AstraZeneca vaccine on the first day that we got the AstraZeneca. So we had a model where we had 10 vaccination teams go out for all of our care homes across the PCN, and all residents were vaccinated on the same day. So it all came at pace, and what we did was we arranged a group Zoom consultation with with relatives and power of attorneys for patients in the care homes, and also for the carers and the care home managers in those care homes. So prior to the to that process, we created lists of all of the patients. We went through them and agreed on who we felt was known to not have capacity to make their own decisions, who we felt has capacity to make decisions. And the care homes were then tasked with sending out an email to each of the relatives, or giving out the patient information leaflets to the patients. The email to the relatives included the NHS information leaflet about the vaccination, and also included the consent form link. So for a patient with power of attorney, for those relatives, they were sent the specific consent form for power of attorney, for example. The email also explained that relatives who did not have a power of attorney but had a relative in a care home who did not have capacity to consent, they could not consent on behalf of another adult. But we were very interested to hear their views, because that would help us to inform us regards best interest decisions. So that was sent out to all of the relatives and carers, along with a link to a Zoom consultation, which we held at 7 o'clock in the evening, 2 days after that email was sent out. So on the night of the Zoom meeting, we started off, and the first half hour was just for the care home managers and care home staff. It's good to get a list of whose names they are, and to ask the care home staff that when they log on to Zoom, if you do it by Zoom, that they log in with their name, because sometimes we had people checking in and it said kind of a certain person's iPad, for example, and it wasn't the name of the person. So when you're trying to let people into the webinar or to the meeting, it's useful to know who you're letting in advance. So we had a really useful meeting with the care home staff, where we went through with them about what the vaccine is, a bit about the evidence that's available, that it doesn't change how they should act, in terms of they should still make sure they're safe and keep the distance and wear masks and protect the residents. And we went through the process for the day. So we described to them what was going to be happening. And for those that were currently having an outbreak, we talked about risk assessments and how we would continue to vaccinate and how we were going to do that process. We set up for them that we want what our expectations were of them, and the help that we needed for them in terms of monitoring the care home residents afterwards, and making sure that the patients were all prepared, that they made sure patients were socially distanced. If they did put them, bring the residents into, for example, a day room, that they were socially distanced and they didn't crowd the day room, because the last thing we want is to promote an outbreak. And then we took questions from them, which was it was really positive questions and feedback. And then we opened the meeting up, and we invited in the carers and the relatives and friends that were interested. And again, we went through, so we explained a little bit about what the vaccine is, a little bit about the evidence, and tried to predict some of the questions that might come up, as we thought, in terms of the questions around the delay for the second vaccine, questions around which vaccine they were getting and which one was the best vaccine, and they were common concerns, so we tried to address them up front. And then we took questions, and we asked people to put questions in the chat if they were able, and then we read out the questions from the chat and just answered them as we went. And then those that wanted to ask a question verbally, then they did. We were quite clear that we weren't going to answer specific questions about their specific relative, because obviously it wasn't a confidential environment, and particularly if their relative can't consent, they can't consent for relatives discussing in front of a public forum. So we took general questions, but it was a really, really positively received meeting. Lots of great feedback, both within the meeting and then on social media afterwards. I had care home staff and relatives commenting on the Facebook pages and on Twitter about how amazing it had been. And I think it really helped to reduce the activity on the phones as well. So the day after, we had only one question come in on the phones from a relative, and they apologised that they weren't able to attend the meeting, and they had a quick question that was quickly dealt with. But I think that was the only query we had. So it was brilliant at reducing that workload of queries about the vaccine, and that you could just talk to everybody that needed to ask their questions in one foul swoop, and also address the myths and the concerns as a group. So in all, I'd say it was a really efficient and useful and well-received method of communicating with our patients, and particularly useful as we were trying to roll out the vaccination programme at pace with very short notice for them. And it helped them engage, and they got the consent forms back quickly to us, and we were able to head out and vaccinate all of our care homes within 48 hours of that meeting. So it was really well received, and a great idea, I think.